Hello, everyone. My name is Shania Cisco, Master's of Science in Nursing Education student at Georgia Southwestern State University. And today's presentation will be focusing on a specific assessment method, which is multiple choice questions. All right, so first things first, what is multiple choice assessment method? It is a way to evaluate the knowledge of a learner through questions that present one correct answer along with incorrect answers. There are a couple of different types of multiple choice assessment methods. We have true or false, select one answer, and select all that apply. Through the different types, professors are able to create questions that are factual, such as anatomy questions. We also have application-based questions, or those that require critical thinking skills and problem solving. Do y'all remember the EOGs that we took in grade school? The end of grade testing that evaluated what we learned that school year. And they were used as a tool to assess if we were ready to move on to the next level of learning or the next grade. I do. I remember being in third grade so nervous, just hoping that I scored well. Well, those tests utilized the method of multiple choice assessment method. All right, so now we're going to go through the advantages of using the multiple choice assessment method. First, we have consistency in grading. Every student receives the same number of questions and answer choices. Multiple choice questions also eliminate grading biases such as handwriting or wording. They allow for a fair assessment for every student. Now we have results from quizzes, tests. They have a quicker turnaround. Because there are set answers for each question, instructors are able to grade quizzes and tests faster, which just provide for a quicker turnaround, allowing for students to receive the feedback and address their strengths and or weaknesses quicker. Last but not least, another advantage is that it helps with preparation for NCLEX. With the NCLEX being mostly multiple choice questions for testing, incorporating this question format throughout the course of nursing school helps students become comfortable with how to address those questions. Now, on the flip side, we have the disadvantages. First off, we have memorization, a limited depth in knowledge. So I know for me, I was the queen of mnemonics. I didn't understand why it was the right answer, but I knew which answer to select. While yes, I did memorize the correct answer, I didn't know why it was the right answer and would have probably had a mind blank if the question on the test were put into real life scenarios where I had to tie in critical thinking. So that is one thing to consider. Second, we have the guessing factor. Students that don't know the answer at all have a 25% chance of getting the answer correct. Some may even be able to give themselves a 50-50 chance at the question. With that being said, students can guess the correct answer without fully understanding the material. And last but not least, inability for the instructor to correct in real time. If you're anything like me, you have to stop my train of thought in its tracks and reroute it, or else I keep going down the path I'm on. With multiple choice questions, instructors lose the opportunity to correct the student's thought process in real time, which personally I feel is the most effective way of learning. So now we're going to jump into developing a multiple choice assessment question. First things first, identify what you're assessing as it relates to course objectives and content. Second, create the question and make sure the answer choice is correct and able to be validated. 3, create other answer choices, ensuring that they are just as complex but not easily mistaken as the right answer. So, there should be one correct answer. Even if you're asking questions like, what would you do first? Or what is a priority? There will still only be one correct answer. So when creating multiple choice assessment questions, you don't want to put all correct answers in that list of answer choices. The goal is not to mislead or to be tricky when it comes to questioning, but to really test the knowledge of the student being tested, which in this case, we're referring to nursing students. Now, keep it in mind, as I said previously, if you are asking questions like, what would you do first, or what is a priority, those answer choices may be correct as it relates to that patient, so to speak. But if you are identifying first or priority, you still are narrowing it down to one specific correct answer. All right, exam time. So to wrap up this presentation, we're going to go through 3 questions that I created, showing 3 different types of multiple choice questions that can be created under the specific assessment method of multiple choice questioning. All right, first up, true or false. A patient diagnosed with type 2 diabetes is scheduled to have his blood glucose checked, ACHS. The nurse goes in to check his blood glucose with a glucometer before lunch and gets a reading of 98. This reading is an average reading of the patient's blood glucose reading over the last couple of months. True or false? False. A1C testing measures average blood sugar levels over the past 2 to 3 months to monitor for long-term management. A blood sugar check measures the current blood sugar level at that specific moment and assists with being able to make immediate adjustments to glucose levels. All right, next we have select all that apply. A patient is admitted to your unit with low levels of TSH and high levels of T3 along with T4. The provider is suspecting that the patient has an overactive thyroid. As a nurse, what symptoms might you see in this patient? Select all that apply. So we have a list: cold intolerance, increased sweating, nail thickening, slow heart rate, diarrhea, and nervousness/anxiety. And there we have it. So hyperthyroidism is the first thing that you have to consider. Oh, what are they asking me? Hyperthyroidism. So now we are able to think, okay, what symptoms are associated with hyperthyroidism? And related to this specific question, we will be clicking increased sweating, nail thickening, diarrhea, nervousness, and anxiety. Last but not least, select one answer. You're doing a head-to-toe assessment on your 38-year-old patient admitted for appendicitis. Upon assessment, you notice that your patient's abdomen is distended. Which of the following comments from your patient would raise concern that this is an emergent situation? A. When I came in through the ER, my pain was a 5 out of 10. I would now rate my pain an 8 out of 10. B. There was broth and a lemon icy delivered on my tray this afternoon. C. My pain was an 8 out of 10, but all of a sudden, my pain is a 0. I think I'm all good. D. The nurse before you gave me ice packs to put on my abdomen. Can I have another one of those? And the correct answer here was C. Remember, the question was which would raise concern, meaning out of the answer choices, which one is like, oh no, this is a big no-no. C, my pain was 8 out of 10, but all of a sudden, my pain is a 0. I think I am all good. Sudden pain relief is a sign that the patient's appendix may have burst. This is an emergency and needs immediate attention. All of the other answer choices were correct. The pain increasing is normal. A diet that is easily digestible is most appropriate for a patient admitted with appendicitis. So broths, fluids, bland food, and heat should be avoided on the abdomen as it may cause a rupture. So ice is recommended. The end. Thank you so much for your time. If you have any questions, feel free to reach out to me. I will be happy to help them. Creating this presentation was extremely fun, and I hope you use that multiple choice assessment method.